All right, welcome everyone. We'll start. Um, so this is on the topic today is BPH, and the prostate is a walnut-sized gland located at the base of the bladder, and it surrounds the male urethra. If you look at the picture on the left side is normal. Sorry, is the normal one, and on the right side you will see an enlarged prostate. And now this enlarged prostate can cause symptoms, which we'll talk about a little later. The prostate secretes fluid that becomes part of the seminal fluid and it carries sperm. And it depends on androgens, testosterone, and DHT, which is dihydrotestosterone, for development and maintenance and function. The enzyme 5-alpha reductase converts testosterone to DHT, and DHT is responsible for normal growth of the prostate as well as hyperplastic growth. Now, hyperplasia, hyper means to grow, plasia is the cells. And so on the right side, if you look, if there's hyperplasia, the enlarged prostate can cause symptoms known as LUTS or lower urinary tract symptoms. Now, because of the direct bladder outlet obstruction, the urinary bladder itself will have increased smooth muscle tone and resistance. Normal age of onset is over 65. You may interact with patients that are 50 or 60. However, this is a condition of seniors. All right, very good. Continue. Just want to make sure you can hear me and see the slide that says drugs that can worsen BPH. Good. So we have centrally acting anticholinergics like benztropine. Antihistamines is another one. An example of antihistamines is diphenhydramine. Can anyone tell me what the brand name is for diphenhydramine? It's okay if you don't know, but go ahead and try. All right, V Farm with an answer. Good. Vicky with an answer. Good. So diphenhydramine is Benadryl. Good job. If you're unsure, that is okay. Just keep in mind that the Naplex does like to test the top 300 brand names. Suspicious Bunch, another moderator, has shared a resource to help you memorize. Try to do a little bit every day. It's hard to remember and recall this many. Good job, everyone. Next, we have decongestants like pseudoephedrine, phenothiazines like prochlorperazine, and then TCAs, tricyclics, like amitriptyline. And all of these can worsen BPH through their anticholinergic effects. Caffeine, diuretics, and SNRIs also can worsen BPH, as can testosterone products. Ignore the last bullet point, it's a typo. And now we come to symptoms. Symptoms of BPH are increased frequency, straining to urinate, weak stream, and hesitancy. Hesitancy is going to be someone wants to go and they have trouble starting. You also have urgency, leaking, dribbling, and nocturia. Can anyone tell me what nocturia is? Very good. I have an answer. I have two. Good. Good. Seems like most of you are familiar with this concept. Good job, everyone. It is having to urinate at night. And then you also can have incomplete bladder emptying and obstruction. And obstruction can lead to kidney symptoms or renal failure. Good. Next, we'll go to drugs for BPH. There are three main classes. The first one is alpha blockers. Second one is 5-alpha reductase inhibitors. And the third one is going to be PDE5 inhibitors. So let's start with alpha blockers. These drugs are first-line treatment for moderate to severe symptoms. The mechanism of action is going to be inhibiting the alpha 1 adrenergic receptors, which help relax smooth muscle in the prostate and the bladder neck. This reduces the bladder outlet obstruction and improves urinary flow. Now, there are three types of alpha 1 receptors. Can anyone tell me what they are and or where they are found? Any combination? Mm, Nikki, can you hear me? Can everyone hear me? Okay. Nikki, just let me know when you can hear me again. So VFarm uh, answered the question 100% correctly. So alpha 1A are found in the prostate. Alpha 1B and the alpha 1D are found in the heart and the arteries. And so if we look at non-selective, they have less, I'm sorry, non-selective have more adverse effects than selective, greater than. And so keep in mind that if you're going to use a non-selective agent or the patient is on that, they will have more adverse effects than a selective alpha 1 blocker. Something important for you to know, floppy iris syndrome. I know that both RxPrep and past Naplex now go over this. There's reduced iris muscle tone during cataract surgery due to the alpha 1 blockade, and that is because the muscles of the iris have alpha 1 receptors. I briefly touched on this yesterday when we did common disorders of the eye and ear. So make sure that the physician is aware in case they're going to have cataract surgery, or the patient knows to let them know that, hey, these are the medications that I take. Now, non-selective agents for BPH are going to be doxazosin. There's an immediate release and an XL version. The immediate release is going to be 1 milligram at night, and you can titrate slowly up to 4 to 8 milligrams. For the XL version, it's going to be 4 milligrams daily with breakfast and up to a max of 8. Next, we have terazosin. Terazosin is going to be 1 milligram at night, and we titrate slowly up to a max of 20 milligrams. Most patients will probably be in the 10 milligram range when you titrate up. Melissa, welcome. Next, we have the selective alpha 1 blockers, and that's going to be tamsulosin, which is zero point 0.4 milligrams daily, 30 minutes after the meal, and you want to take it the same time every day. So whether you choose breakfast, lunch, or dinner, make sure it's the same. And there's a max of zero point 0.8 milligrams. A couple other selective alpha blockers are going to be alfuzosin and silodosin. All right. So that's alpha blockers. Next, we have drugs. We have 5-alpha reductase inhibitors. And this is going to be finasteride and dutasteride. So, can anyone tell me what a brand name is for finasteride? The mechanism of action here is going to be inhibiting the enzyme, which is 5-alpha reductase, and that's going to inhibit conversion of testosterone to DHT. I have a couple answers. Good job. Good job. Proscar. Good. Propecia also. And Art, yes. VFarm has added that Propecia is going to be for hair. Good. I was just going to clarify for Art. Good job. So, uh, it's used in combo with alpha blockers. It improves the symptoms. It decreases urinary retention and can possibly avoid surgery. So maybe someone who has severe symptoms, we can bring it down to moderate, and maybe someone with moderate, we can bring down to mild. Now, finasteride, which we talked about, is Proscar, is selective for the type 2 enzyme of alpha 5 alpha reductase. And those type 2 enzymes are prevalent in the prostate, and 5 mg daily is the dose. Another 5 alpha reductase inhibitor is going to be dutasteride. If you can once again help me with a brand name, dutasteride is going to be non selective, meaning it covers both type 1 and type 2 5 alpha reductase, and it is 0.5 mg daily. Couple contraindications here. Uh, Women of childbearing potential, women who are pregnant. It is on the NIOSH list of hazardous drugs, and broken tablets can soak in through your skin, and so you want to be very careful handling it. Now, the 5 alpha reductase inhibitors are, there's some research. This is academic, not necessarily for the Naplex. Suspicious welcome. That for low grade prostate cancer, it may be beneficial to have 5 alpha reductase inhibitors, but for high grade prostate cancers, it can increase the risk or worsen those conditions. So, still TBD, but keep an eye out for that. Now, adverse effects of this class are going to be impotence, decreased libido, breast enlargement, and tenderness. You're supposed to monitor the PSA and urinary symptoms, and that will be it. Good job, those of you that answered Avodart. All right, our next slide is going to have the third class of drugs. And this third class of drugs is going to be phosphodiesterase 5 inhibitors. And these have a mechanism of action where they decrease smooth muscle and endothelial cell proliferation. They also decrease nerve activity, increase smooth muscle relaxation, and decrease tissue perfusion of bladder and prostate, thereby reducing the size. Tadalafil is the only FDA approved treatment of BPH with or without erectile dysfunction. Can anyone share a brand name of Tadalafil? Now, the dose for this is 5 mg daily at the same time at night. And there are some serious contraindications. We do not use PDE5 inhibitors with nitrates. You're supposed to wait 48 hours between doses. So, and it's both ways. If you're taking a nitrate, wait 48 hours to take tadalafil. If you're stopping tadalafil, wait 48 hours to start a nitrate. They can cause additive hypotension. Good job, everybody. Cialis, add Circa IC for pulmonary arterial hypertension. Good. So, excuse the cough and throat allergies for spring. While the flowers are beautiful, it feels like they are definitely causing some trouble for me. So, we want to be careful. Some adverse effects are headache, flushing, dizziness, and dyspepsia. And you want to be careful if the patient is on 3A4 inhibitors, if they complain about impaired color discrimination, which this impaired color discrimination can be dose dependent, vision loss, and priapism. We monitor the PSA, blood pressure, as well as urinary symptoms for tadalafil. Good job. So now we'll go on to some key counseling points. And here we have, for alpha blockers, there's going to be orthostasis. And then, of course, with cataract surgery, the floppy iris syndrome we talked about, doxazosin and terazosin, which are non-selective. Make sure you take at bedtime and, excuse me, counsel the patient about the possibility of a ghost tablet in stool. Can anyone tell me what a ghost tablet is? If you're unsure, let me know also. So while we give everyone a chance to respond, this is um, this is important because a patient may come to you and ask, I noticed this. Okay, good. So I'm getting empty shell, and Nikki got technical with the Oros tablet. The drug has been released, and the only thing that's remaining is the empty shell. Good job. Good job, everyone. And so it's important to know. Concerta is correct, while Butrin XL also has a ghost shell. There are quite a few. So, psilocin can cause retrograde ejaculation, and it is supposed to be reversible upon cessation of psilocin. For 5-alpha reductase inhibitors, they can cause sexual dysfunction like decreased libido, ejaculation disturbances, and erectile dysfunction. We want to avoid in pregnancy because they are teratogenic and take precautions in handling. This should be a USP question as well. That's commonly tested. NIOSH, hazardous list. How do you handle them? Good. You may see that more on the MPJE or the CPJE. Next, the AUA, which is the American Urological Association, it does not recommend natural products like saw palmetto. I believe there's a pumpkin seed, and maybe lycopene is marketed, but there's no research to back that up yet. And then for caution with PDE5 inhibitors, uh, due to additive hypotensive effects, which is something that I talked about. All right. So I have a practice question for everyone. And what we'll do is I'll read the practice question. At the end, I'd like you to choose an answer. And here, this one is select all that apply. And so remember, it can be one correct answer, or all of them can be correct, or it can be anything in between. There is no pattern for the Naplex. I have noticed in RX Prep and past Naplex now, they do a great job about not making a pattern. Just remember, if you know it, good. If you don't, make your best guess and then note it to review later. And then after this, I'll open up the floor for any questions you may have. So, a 72-year-old male presents to his PCM with continued increased frequency, an urge to urinate, and cannot completely empty his bladder. His past medical history is significant for hypertension, hyperlipidemia, BPH, GERD, and hypothyroidism. Current medications are lisinopril 10 mg daily, amlodipine 5 mg daily, torvastatin 40 mg daily, tamsulosin 0.4 milligrams daily, omeprazole 20 mg daily, and levothyroxine 125 microgram daily. Please excuse the typos, I will fix those. Based on the size of prostate and lack of effectiveness with current therapy, his PCM elects to initiate Avodart 0.5 mg once daily. And once again, Avodart is going to be dutasteride. The question here is what counseling points would be appropriate for our patient? A. While Avodart will help BPH symptoms, it will also decrease risk of prostate cancer. B. Maximal effects of Avodart will occur within first month of therapy. C. Once initiating Avodart, do not donate blood until therapy has been discontinued for at least 6 months. D. Women of childbearing age should not handle Avodart capsules due to potential risk to male fetus. And last but not least, choice E. Our patient's tamsulosin should be discontinued once patient has been on Avodart therapy for 30 days. For the newcomers, you're welcome to write I'm not sure or this is a guess. I will go over all of the answer choices in detail. See, someone said they can't see the screen. I'm going to try this one more time. All right, hopefully that helps. I'm here. V-Farm, can you hear me? Okay, good. I was just gonna wait for see if a couple more wanted to try it, and then we will continue. All right. So I have some students chose A and D, some chose A and B. Now let us break it down. The first one says, while Avodart will help BPH symptoms, it will also decrease the risk of prostate cancer. So, uh, the first part of the question is correct. It will help BPH symptoms. However, the second part is incorrect. It has not been demonstrated. It does not have an FDA indication for decreasing cancer risk. And then something I talked about earlier is for high grade cancer, it can increase the risk or worsen it. So unfortunately, A is not the correct answer. Next, B. B is incorrect because dutasteride should be trialed for up to 6 months before making a decision of the effectiveness. That's how long it takes for complete hormonal inhibition to occur. So unfortunately, answer choice B is incorrect. Next, we have answer choice C. C is correct. If once you discontinue Avodart therapy, it takes about 6 months uh, for the complete washout. And this will limit any exposure for any female of childbearing age or pregnant patient who receives a blood transfusion. I try to donate blood several times a year, and this is on the questionnaire. It is one of the specific drugs. Are you taking it, and when was your last dose? So, choice D is also correct. That is something that we talked about. It's on the NIOSH list, and it is a caution. Now, E is incorrect. I'm glad no one chose it, but they're used in combination long term to decrease overall BPH symptoms. So, once again, the correct answer choices were C as in cat and D as in dog. And this covers areas 1, 2, and 3. We identify drug characteristics, you're assessing, and you are counseling. Yes, Art has a question why B is wrong again. B is incorrect because it can take up to 6 months for complete hormonal inhibition to occur. If you recall the class of drug and the mechanism of action, and you can quantify that it'll take up to 6 months. So 1 month is not enough time to gauge whether the maximal effects have taken place. Any questions about this practice question or concerns? Feel free to ask at this time. Yes. Vicky says the second part said male fetus. Uh, it probably would affect both. Anyone have any other questions or concerns for this practice question that we did? And I'll open the floor to general questions about the Naplex, your prep. If you have specific questions about one-on-one or group sessions that I do, feel free to send me a chat or direct message. Happy to answer any questions or concerns that you may have. So Nikki asked, is floppy iris syndrome permanent? So it doesn't happen unless you have surgery while taking alpha blockers. It is an adverse effect you need to watch out for. If there is damage to the iris, that's not reversible, but you can stop taking alpha blockers and then have your cataract procedure to prevent floppy iris syndrome. I hope that answers your question. Good question, Nikki. Thank you. Anyone else have? Thank you, VFarm, for the added information. Nice to have helpful group members. All right, Art asks for renal dose adjustments. How should we study this section? So the renal dose adjustment section is very important. You do need to know the bold and the underlined. Uh, it helps with association. So with conditions, for example, if they're HIV drugs, which by the way, Suspicious Bunch has a great guide for HIV. Make sure you review that if you have time before your exam. And you should do an association, the different levels of creatinine clearance, uh, and then some of it may end up just being memorization. I get asked this a lot. If you're a retail pharmacy, how much hospital are you supposed to know? If you're a hospital, how much retail you're supposed to know? Then, of course, there's someone who's going into nuclear pharmacy who's trying to memorize as little as possible for uh, both retail and hospital. Art, if you go to, anyone can help me out. I think it's in event recordings. There's one. And Vicky said notes resources. That sounds right also. I have about 5 more minutes if anyone else would like to ask any questions or concerns.